Good evening and welcome to Transition Talks Tuesdays. My name's Tim Markle. I'm director of the Wisconsin Youth Health Transition Initiative. Transition Talks Tuesdays is a part of our effort at Transition Talks at Youth Health Transition to get the word out about transition, to help families prepare and help professionals know what the different parts of transition are. This fall edition of Transition Talks Tuesdays are being done with partnership with the Autism Society affiliates of Wisconsin, Greater Wisconsin, South Central Wisconsin, and Southeastern Wisconsin, as well as the Children's Resource Center South. We thank them very much for partnering with us. Tonight, we are going to learn about disability work benefits and how to navigate working and hold on to public benefits and what that balance looks like. And so we have Sarah Schroeder here who works with ERI. She is a work incentives benefits counselor, and we're excited that she is here to talk to us tonight. So Sarah, I'm going to go ahead and I'm going to spotlight you for everybody. And you just go ahead and take it away. Thank you so much for being here.
All right. Well, thank you. Thanks for inviting me. So as Tim said, I'm a work incentives benefits specialist from ERI. I've been there for about 9 years. And I am the current program manager of the work incentives planning and assistance program, which I'll talk about a little bit later. But we're going to talk just about how people can work and keep their benefits. So let's just get started. All right. So many individuals believe that they can't work because they're going to lose important benefits, such as health insurance. And that is not always the case. Working and benefits kind of work together. So with Social Security benefits, there are something called work incentives that allow people to work and sometimes work full-time and keep their benefits. And definitely, most people's most important want to keep is their health insurance. And almost in every case, people who are on benefits or might even work off of benefits are still able to keep, health insurance such as Medicaid. All right. So paid employment and Social Security disability benefits don't have to be mutually exclusive. A lot of times you can do both. And it's possible to work, like I said, even sometimes full-time and keep your Medicaid and or Medicare. And it's possible to, for the most part, come out ahead financially, even if your benefits are reduced or stop. And it is possible, even if you do work off of benefits, to get them back if they are, if you stop working or have lost your benefits because you were working over the limits. And the most important thing to remember is that each person's benefit situation is different. Some people are on SSI, some people are on SSDI. You're getting different amounts. There are several different Medicaid programs that people can be on. So, if you're hearing from a neighbor or a friend or whatever it is, that this is what their situation is, it's not necessarily what's going to happen in your situation. So the best thing to do is to contact a benefits specialist so we can verify benefits and then talk specifically about what's going on with your situation. So work incentives benefits counseling is available to provide that individualized information and support that is specific to your situation. So I wanted to just go over kind of the basics of both SSDI and SSI, and then also health insurance. So SSDI, or Social Security Disability Insurance, is a Social Security benefit based either on a person's own work record because they have worked enough and paid into the Social Security system and are eligible for this SSDI, or could be eligible on the record of a parent who is either has a disability themselves, is retired, or is deceased. And to be eligible on the record of a parent, the child's disability must have started before age 22. I guess one of the main differences between SSDI and SSI is that there is no asset limit for SSDI versus SSI, as a lot of you probably know, have a $2,000 asset limit, or like money you can have in the bank. So SSDI is a lot more, you don't have to keep that money under the limit. They don't care how much you have in the bank. Their main thing is just to make sure you're earning under their limits, which we'll talk about a little bit later. SSI, or supplemental security income, is mainly for people who are younger or haven't had as much work experience. So they haven't been earning their quarters or paying into the Social Security system, so they aren't yet eligible for SSDI. SSI is needs-based, so it's specifically for people who have low income and low resources. And there is a limit to how much you can get in SSI. The most that a person can get in SSI this year is $943 per month. And next year that will increase to $967. Whereas with SSDI, that is based only on a person's work record. So it's going to be, there's really no limit to how much it can be. It just depends on how much you've worked in the past. And some people can be on both SSDI and SSI at the same time. Everybody who's on SSI gets a state supplement. There are two amounts. There's an $83.78 state supplement, which is the basic supplement. And then for people who need extra help, or at least 40 hours of extra care, they may be eligible for an additional $95.99. So that would be $179.99. So a lot of people who are on long-term care benefits, such as IRIS or family care, could be eligible for that additional $95.99 state supplement. So if you have questions about that, what you would do is either contact your IRIS consultant or the local consortium. And if you have questions about that, you can always contact me as well. But for SSI, there are, income and asset limits. Like I said, the limit for SSI is $2,000. With SSI, you get automatic Medicaid. And you can receive SSI as a child. Or as an adult. And we'll talk a little bit about there's an age 18 certification once a child turns 18 to see if they're going to be eligible as an adult. So with SSDI and SSI comes different health insurance. With SSDI, once you've been on that for 2 years, you become eligible for Medicare. Medicare is not as comprehensive as Medicaid. Usually with Medicare, they're paying 80% of whatever the bills are, and then you have to pay that 20%. Most people I work with have both Medicare and Medicaid. So if you have Medicare and they're paying that 80%, Medicaid is going to pick up the 20%, so there shouldn't really be any out-of-pocket costs. But if you've only got Medicare, then there may be some additional out-of-pocket costs. But Medicare has parts A, B, and D, and sometimes C. And I'll talk about that in the next slide. And then there are, to help with some of these additional costs for Medicare, there's something called the Medicare Savings Plans and the low income subsidy for prescription coverage. And again, I'll talk about that in a little bit. But Medicaid is a more comprehensive coverage. And it has 2 different parts. One is the Medicare Savings Plan, and the other is the Medicare Low Income Subsidy. And I'll talk about that in a little bit. But Medicaid is a more comprehensive coverage. And it has 2 different parts. One is the Medicare Savings Plan, and the other is the Medicare Low Income Subsidy. Again, there are almost usually but very little out-of-pocket costs for Medicaid, except for copays. And again, there are several different programs or types of Medicaid that people can be eligible for. So even if you don't have SSI and you're working, you can most likely be eligible for Medicaid and keep that healthcare coverage when you're working. Each type of Medicaid has its own income and asset limits, and I'll go through all of the different Medicaid programs on another slide. But some do have premiums or cost share. So there sometimes are out-of-pocket costs for Medicaid, but they're usually pretty low. So Medicare, again, Medicare comes if you have SSDI. And then again, SSDI through your own record of working or through a parent's record. So there are three main parts of Medicare. A, which is hospital coverage, and that is always free. B, which is the doctor coverage, which is sometimes free and sometimes has a monthly premium. If you do have to pay that premium this year, it's $175 a month. And then there's Part D, or prescription coverage. And whether you have to pay any premium for prescription coverage depends on whether or not you're enrolled in a low-cost plan. And then there are also C, or advantage plans, which are plans which are covered through private health insurers, and they actually cover all of your A, B, and D coverage. So you're either going to have A, B, and D or C. But if you ever become eligible for Medicare and you have questions, there are experts out there that you can call that can help you decide, what prescription plan to sign up for, if an advantage plan might be good for you. So, if you become eligible, don't worry about it. Lots of help out there. But just to kind of mention with C, or an advantage plan, a lot of folks are signing up for those because they have additional benefits, such as vision coverage, dental coverage, and a lot of them also come with grocery cards where they'll help, they'll pay you like $100 a month or something like that for groceries or over-the-counter items at the pharmacy. So some of those have a nice extra benefit. And again, there's something called a Medicare Savings Program or Medicare Savings Plan. Depending on your income, you may be eligible for that. If you have Medicare, which would cover the Medicare Part B premium, which I said before was $175 a month. If you've got SSI, that is automatic, so you never have to pay that premium. With other types of Medicaid, you may have to, but with SSI, it's always paid for. And then that Medicare Part D low income subsidy helps pay any out-of-pocket costs for prescriptions, including premiums or deductibles.
There we go. Sorry, you were gone there for a second,
Oh.
Sarah, but now you're back.
Okay, good. So I was just saying that the Part D, if you're signed up for a low income, if a Part D low income plan, you shouldn't have any out-of-pocket costs for that except for some copays. Normally I would be wearing some headphones, but they broke today, so. So hopefully I won't go out too often. So then with Medicaid, that comes automatically with SSI. And again, you have the automatic Medicare Savings Program. So with SSI and SSI Medicaid, there shouldn't be too many out-of-pocket costs. And you just have to show that one card, the Forward Health Card, for all of your prescriptions and doctor visits. but there are many types of Medicaid. So for folks who don't have SSI, and don't have SSDI, so somebody who might not be on benefits yet could be eligible for something called Badger Care Plus. And that covers both children, adults without children, and parents. And each type of those, so for the kids and the parents, have different income limits. But Badger Care does not have an asset limit at all. So if you were a adult with no children, to continue to be on Badger Care Plus, your income would have to be below $1,255 a month this year. But if you're on Badger Care Plus and you have questions, that's where a benefit specialist would come in. Again, SSI Medicaid comes automatically with Medicaid. And you keep that even if your Medicaid or your SSI payment stops. I'll go through a little bit more, but there's something called 1619B where you can earn up to, it's like $46,000 a year and keep your SSI eligibility, which means you keep your Medicaid. There's categorically and medically needy Medicaid. Those also have different income limits, and you can continue to be on those if you pay a deductible. Special status DAC Medicaid is for folks who were on SSI at some point and then got kicked off because they became eligible for SSDI on a parent's record. And that also comes with an automatic Medicare savings program, which means no Medicare Part B premium. The two that I really wanted to focus on are the last two, the Medicaid Purchase Plan or MAP, which is specifically for people who have a disability and are working. It has a very high income limit. So even for folks who are working full-time, a lot of times can continue to get Medicaid through the MAP program. If you're not getting benefits, you can earn, I don't want to say it for sure because I'd have to figure it out, but I think it's about $60,000 or $70,000 a year and continue to get that MAP coverage. And the nice thing about MAP is that instead of a $2,000 asset limit, which most of these other Medicaid programs have, it has a $15,000 asset limit. So the plan, the point of this program is to keep Medicaid while you're working and also be able to save more money. And then Medicaid waiver is for folks who also have long-term care benefits like IRIS or family care. And again, each type of Medicaid has their own income and asset limits. So when you're kind of figuring out how much you can earn and work and whether you're going to be able to keep Medicaid, it's a good idea to contact, a benefits specialist because we can verify which type of Medicaid you have and talk about what those income limits would be for you to keep that. Right. So there are some different specific work incentives for SSDI. So work incentives consist of a series of phases for SSDI, and each phase provides a level of protection from loss of benefits and provides different ways to keep those benefits or get them back if needed. So some of the phases include the trial work period, which that is 9 months where there's no earnings limit to keep your SSDI payment. So somebody could earn $10,000 a month for 9 months and keep their SSDI payment. So it's people use that trial work period a lot if they're thinking about working full-time and maybe hoping to work off of benefits and no longer rely on the benefits. It gives somebody, close to a year to work and kind of try that work before the benefit would end. And then even after the trial work period, there's something called the extended period of eligibility, which is an additional 3 years where you continue to be eligible for SSDI, even if you're earning too much to get your payment. So that means, if you aren't getting your payment because you're working, but then something happens and you have to stop working or reduce your earnings, you can get back onto SSDI and get that payment back pretty quickly. There's something called the grace period, which allows you to get 3 additional payments of SSDI before your payment stops. And the extended period of Medicare coverage, which allows you to keep Medicare for close to 8 years after the trial work period ends, even if your payment stops. So, there are these work incentives where you can keep getting your payment or at least keep eligibility for your benefits for a period of time so that you can get it back if something happens. And that includes that extended period of Medicare coverage. So you keep some health insurance. With
Sarah,
SSDI.
really quick, we did have a
Yeah.
question come in.
Yeah.
When you're talking about the asset limit for, I believe we were talking about SSDI, does that exclude any of the financial tools such as a living trust or an ABLE account?
Good question. So yeah, so Medicaid, they have that either $2,000 or $15,000 asset limit. And any money that's in a special needs trust or an ABLE account does not count as an asset. So once the money's in either that special needs trust or the ABLE account, it's not going to be considered an asset when we're looking at that $2,000 or $15,000 limit. So those are some really great ways to save more money and keep the benefit. And if you need more information about ABLE accounts, I can send that out. There's a really great website, ablenrc.org, which is the National Resource Center for ABLE accounts, but it's got a really great frequently asked questions section, a lot of webinars all about ABLE accounts. And then in Wisconsin, WISPACT, which is wispact.org, is the place where people sign up for special needs trusts, and they also have a frequently asked questions section with a lot of information. All right. So just a little bit more about SSDI. So they're looking at, once the trial work period is over, they're looking at whether somebody can earn at a substantial gainful activity limit. So that's what they're looking at to determine if somebody should continue to get their payment and whether they continue to be eligible for SSDI. So just to let you know, like this year, if somebody earns below $1,550 gross per month, they can continue to get their SSDI ongoing. So as long as they do that, their cash benefits continue. And then there are actually special work incentives that help, that may apply to reduce countable income, such as subsidy if somebody gets extra support at work because of their disability, if they have a job coach, if some of their tasks are different because of the disability, that can be taken into consideration. And sometimes people can actually earn over that substantial gainful activity limit and keep their benefit. A lot of people get kind of confused about SSDI versus SSI because with SSI, there's a gradual reduction of benefit as you work. As you work, your payment goes down, but you keep some of it. With SSDI, that doesn't happen. It's all or nothing. So you either get all of your payment or you get none of it. And that's another reason why it's a great idea to contact a benefits specialist, because it can be really confusing as to what the different rules are for each of the benefits. SSDI, SSI, Medicare, Medicaid, they all sound the same. So it can be really confusing if you're not sure. With SSI, there's some work incentives specific to that as well. There's the earned income exclusion, which is means a little less than half of somebody's monthly earnings are counted when Social Security is deciding how much the SSI payment should be. So, you know, if you're making $1,000 a month, 500 about will be counted, and that's how much your SSI payment would be decreased. Pretty much for every $1, for every $2 that you earn at your job, your SSI payment goes down by $1. But even if you earn enough that your payment stops, you keep your eligibility for SSI, which means you can get your payment back depending on your earnings the next month. And you keep that Medicaid eligibility as well, even if you're not getting that payment. With SSI, people almost always come out ahead by working. Even though your SSI payment is decreasing, you're ending up with more at the end of the month because you're also you also have those work earnings. Something nice for students, there's something called the Student Earned Income Exclusion, which allows SSI folks who are under age 22 and attending school can exclude some of their work earnings, which means that they can keep more or all of their SSI longer, even when they're working. So this year, Social Security will exclude up to $2,290 of earned income per month, up to a maximum of $9,230 per year, which means somebody can earn up to that $9,230 in a year and still get their full SSI payment. It won't be reduced at all. And again, even if earnings cause a zero SSI cash payment, Medicaid can continue indefinitely through either 1619B, that Medicaid continuation, or through that Medicaid purchase plan, which is again for folks specifically who have a disability and are working. And that has that high earnings limit and higher asset limit. So what happens if your benefits are terminated? There are ways to get them back. For SSDI and SSI, if someone's benefits are terminated due to earnings, to get back on, somebody can either do a full reapplication, or there's something called expedited reinstatement, or EXR. And this is for folks whose benefits were terminated just due to higher earnings. The other way somebody's benefits can be terminated are through a medical cessation, which is separate. But if somebody's earning enough that their benefits stop, expedited reinstatement is available for somebody whose benefits have been terminated within the last 5 years. Their earnings are continuing below that substantial gainful activity limit, which again, this year is $1,550 per month. The disability that they are reapplying for is the same or related to the original. And if once somebody applies for EXR, while it's being decided at the Disability Determination Bureau if their payment should restart ongoing, they can get up to 6 months of temporary cash payments while that medical review is happening. And so even if the medical review shows that the person doesn't have a disability anymore and they're not going to get the payment back, you don't have to pay those 6 months back. So you're going to get at least those 6 months, and then hopefully you get reinstated and your SSDI would continue, or SSI would be reinstated ongoing. So there are ways to get back on if your payment stops. And with SSI, before your benefits terminate, you actually go into something called a suspension for 12 months. So your benefit would be suspended for up to 12 months before it's terminated if your earnings go high enough that you're over what the 1619B limit, which is that it's like $46,000. So if you're earning more than that, your benefit would suspend. And then during that time, if your earnings go below the limit, you could get your payment back. So yep.
Gonna take you back, I think, one slide, Sarah, to the student benefits possibly. We have a question that, just to clarify, that they could, I'm not sure what they are. I believe it's, so the question is, you say they could count half, so they could earn up to 3,100, and I'm not sure where that number came from. And then if you could just go over again how to get the funds if you're waiting on or not the question is about a determination, but I think it's you only would obtain funds for redetermination. So first, if you could clarify what they're counting half of.
Yep. So for SSI, they're counting half of your earnings. So for every $2 that you earn at your job, your SSI payment is being reduced. And maybe I didn't explain this, but with SSI, Social Security is looking at your earnings every month. So depending on how much you earn, your SSI payment is going to decrease every month. So if you normally get $943 in SSI and you earn $1,000, your SSI payment is going to decrease to about $443. And then you'd get your $443 plus your $1,000 in earnings. So you're going to end up with more with the work. Did that make sense?
Feel free if you need clarification to unmute if you want to ask the question. If you want to help clarify what you're looking for.
And sometimes it's easier when we do something called benefits reports. So we have it all written down. And then at the end of the report, we have a financial snapshot, which shows you exactly what that means. So it's going to give you, if you earn this much, this is what's going to happen to your SSI. And then this is what you're going to end up with at the end of the month. So it's kind of a nice, visual to see and make it a little bit more understandable.
Yeah, Candy, go ahead.
You said that they count half of your earned income, right? So like if they're saying the limit is 1,550, but they're only counting half of that, are you still eligible if you're making 3,100 a month? Because if they're only counting half of it, that was the thing that I needed clarification for. Like, what's the limit of the income that they're actually going to be like, no?
Yeah. So I've already confused everybody. So the 1,550 is actually for the SSDI and the SSI is separate. So SSDI has a 1,550 limit before your payment would stop altogether. With SSI, it's that half. So if you're getting the full 943, you can earn up to $1,967 per month before your payment would stop. But in the interim, between that 0 and 1967, you're still going to get some payment.
Okay, so the gross amount that you would qualify for is that 1,900. Correct?
For SSI,
Yes, for SSI.
the most you can get in SSI is $943.
I apologize when you're talking about like, I'm talking about like, say my child who's going to be an adult gets a job and their gross pay is over 1,900. Would she just qualify for SSI in that month if it's over gross over 1,900? Or are they just going to count half of that 1,900?
So they're counting half of the earnings. So the 1967, if you divide that in two, is like 943. And it's called the break-even point. And it's not quite half, but you can earn up to that 1,900 and still get some SSI payment, just not the full payment.
Okay. But at what point, like, because they're earning half, if you take their income by half, then they possibly would be able to earn more than 1,900 per se, or does it have to be below that 1967?
So it has to be below the 1967 if the person wants to get any type of SSI payment.
Okay, thank you.
Yep.
And then there was another question about requirements for obtaining funds while waiting determination. Is it possible to come off mute and clarify that one for me as well?
Yeah. So I joined late, so I'm confused about, like, I heard something about how someone can obtain a check while they're waiting on a determination. Is that accurate, or how does that work?
So that is actually for somebody, not during the original determination. It's if somebody loses their benefits and they terminate and need to reapply through expedited reinstatement, then they can get up to 6 months of temporary cash payments, but not for the first time that you're applying.
Okay, and is there a certain time frame for our determination to be obtained after a hearing and an assessment has been completed?
For the original application, you mean?
After, like, it's been appealed a couple different times, and now it's after the hearing stage and an assessment was made.
That I am not sure. I don't, for the original application, I know that there are very long periods before somebody is approved, and it can be, up to a year or more.
Okay. All right, thank you.
I forgot to warn people how confusing this topic can be. But this is one of the most confusing with all the initials and the different limits. It's really, really hard. And that's why we're thankful that there are incentive benefit specialists that people can reach out to and get some help on their personal, you can look at the numbers and actually crunch them down.
Yeah, exactly. It's really confusing. All these different abbreviations, they sound similar. And I'm sorry if my explanations aren't clear. It's a little bit easier once we verify benefits and are just specifically talking about, your benefits or your child's benefits. And we do that benefits report and go through everything step by step to make sure that all of the questions are answered. And then depending on the program that you're working with us in, we provide kind of like ongoing case management. So as additional questions come up, benefits change, jobs change, that's what we're going to be there for, to help you through all of that. I think I finished the SSI suspension, so that you're going to have that 12 months of suspension before the benefit would actually terminate. And then just a few things that people should know about their benefits. what benefits they receive. If you're not sure, you can call Social Security, or if you have a My Social Security account, you can go into your account and get a benefits letter. Important records to keep. If you have a job, if you get pay stubs, Social Security will eventually want to see them. Or if you have SSI, they're looking at those every month to determine how much SSI you should get. And I know a lot of people don't get pay stubs anymore. You just get direct deposit, or you've got a portal that you need to go to get pay stubs. So if you can download those, that's, you know, what Social Security would prefer, but there are other ways for Social Security to look at your earnings, either through the IRS annual earnings, and sometimes they can also look at quarterly earnings. But if you get letters from Social Security or Medicaid or housing or whatever it is, try and keep those letters together in a binder, because it just makes things a lot easier, either when you're working with a benefits specialist or when you're contacting that agency to look back and see what's going on. And then I didn't talk about the ERWIs, or impairment-related work expenses. But that is another work incentives for SSDI. If somebody has out-of-pocket medical expenses that they need to be able to work, so it could be co-pays for prescriptions. If somebody has a service animal or an emotional support animal, some of that can be taken into consideration when Social Security is determining if somebody is working at that substantial gainful activity level, which again can allow somebody to earn over the limit and possibly keep their SSDI payment. And then you should also know who you need to report to. So Social Security, when you start a job, stop a job, monthly earnings, depending on what benefit you have. And then the consortium is who you're going to report to for Medicaid and food share. And then if you have Section 8 housing or any type of subsidized housing, you usually have a housing specialist. So work incentives benefits specialist, our goal is to provide accurate information about how working will affect cash benefits, health insurance, housing, and any other benefits a person receives. And again, we do that written benefits summary and analysis report, which will be done specifically around your benefits and what you are specifically receiving. Our goal is to educate beneficiaries or clients about work incentives that are available and how to utilize them. So again, maybe the student earned income exclusion, so that your SSI can continue at the full level even while you're working. If somebody has a job coach and is getting SSDI, we can help get a subsidy form filled out, and again, allow somebody to earn over the limit and keep their payment. And then assist people with understanding who to report to, when to report, and how to report. If somebody ends up with an overpayment, that is something a work incentives benefit specialist can help kind of figure out why somebody got an overpayment, whether or not you know, the overpayment is correct, and if you don't agree with it, helping somebody either appeal that decision or file for a waiver to have the overpayment taken off their record. We refer to other agencies, programs, and services. So it might be the Aging and Disability Resource Center, or somebody who specializes in housing. But if you have questions and we don't know the answer, we will always try and refer you to the appropriate place. We of course help people make informed choices about work. kind of with that, I was talking about that financial snapshot, kind of letting you know if you work at certain levels, what's going to happen? What's the, what's the bottom line as far as how much you're going to have every month, and then making the best decision that you can. We work to improve communication between agencies and beneficiaries. We know can be frustrating to try and get a hold of Social Security or Medicaid, and that can be sometimes be our job to do that communication and get things done a little bit faster, so you don't have to be on the phone all day trying to answer one question, and then resolve work-related benefits problems. So if you're interested in getting benefits counseling or a benefits summary and analysis report, there are a few different ways you can get that funded through DVR, or the Division of Vocational Rehabilitation. And if somebody is working with DVR, they can let their DVR counselor know that they're interested in benefits counseling, and then they can refer to usually there's a list of agencies that are available to do that, and then you pick an agency, and that agency contacts you to do the benefits report. If somebody has long-term care benefits, again through family care or IRIS, the care manager or IRIS consultant can do a referral. Or if somebody is not working with any of those agencies and doesn't have any other source of funding, the Work Incentives Planning and Assistance, or WIPA program, is who you can work with, because WIPA services are free for folks that don't have any other funding source. And if you're not sure which of these you might be eligible for, you can always contact me or ERI, and we can kind of go through it and figure out who you can work with. So just a little bit about that age 18 redetermination. So folks can get SSI as children and then as an adult. The adult definition of disability is different than the child's definition. The adult definition is more stringent. So a child who is getting SSI will not always be eligible for SSI as an adult. The redetermination, it's an age 18 redetermination, so it's supposed to be done after the 18th birthday, usually before age 19, but we have seen it where it's been even up to like age 20. So Social Security is supposed to keep track of that, and then they do it as soon as they can. But for SSI to continue after age 18, the individual has to meet that adult definition of disability. All right. So when should an individual seek work incentives benefits counseling? Pretty much anytime they have questions about work. If you're considering work for the first time, you want to increase your hours so you make more money, you've been out of the workforce for a while and you want to go back to work, if you're developing a career plan and you're maybe thinking about maybe someday you'd like to work off of benefits, that's definitely a good time to contact. When you're looking for a job, or if you just have questions about your current benefits, or if you have benefits issues like an overpayment or something like that. There's really never a bad time to contact a benefits counselor. I always like it when people contact us when they're looking for a job, because that can help people kind of plan ahead and know what to expect as they're moving through, the different phases of work, starting work, making more money, all of that stuff, so that you kind of can sometimes avoid those overpayments or problems if you're already, if you know what to expect. So, like I said, it is possible to work and keep important benefits. You can keep your cash benefits for a time, and usually health insurance for several years or sometimes ongoing. Questions, and I just wanted to go on to the final page because there is my email and the ERI website. So I appreciate everybody's time. I know it's a really confusing topic. It's confusing even to us. Social Security is speaking pretty much like a foreign language. And it's hard to explain, but with benefits counseling, we try and make it as clear as possible. And like I said, we can do case management and just kind of work with you ongoing when questions come up or issues come up to make sure things go as smoothly as possible.
We do have time for some other questions. If anybody has any questions, or if your head is spinning like mine is, as it usually is after this presentation. As I wrote in the chat, it's like just when I think I have a handle on something, I hear something differently. And I'm like, wait, what was that? So it's constant. It feels like it's constantly evolving. So it's good to know that there are experts out there, or people out there that will listen and walk through what somebody has in front of them. So I really appreciate that. Any questions that anybody might want to try to pose? And we will get the recording out. The slideshow will also be available, as well as the resource sheet, which has the links of what I've put into the chat. So you'll get all those as well. Not seeing anybody come off mute. So Sarah, I'll have an extended goodbye here to give people time to process a little bit more. But thank you so much. This is one of those areas where a lot of times um, people will ask someone who thinks they know, and they'll get the answer of, oh no, you get benefits, you shouldn't work. And that's so not right. And so I really appreciate having correct information out here so that people understand they have options. Because work is really important to a lot of people, and we want to feel like we are making a difference. So being able to do that while still receiving benefits and the support that we need is really important. So thanks a lot. Appreciate it. And I will get everything out as soon as I can. Have a great night, everyone.
Thank you.
Thank you.